Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Jose Mendez. Thanks for joining us today, Jose.
Hi, my pleasure. It's really my pleasure, Kim, to talk to you.
Okay, great. I'm really happy to have you.
Thank you.
You're welcome. So I usually start by saying how we met. And in May, you gave a fantastic Zoom presentation for Ann's Place, which is our local cancer support center, about sleep issues. And it was very well attended. And I thought you did a wonderful job of making it just technical enough for the layperson to keep it interesting. And it's
Yeah,
my understanding that you presented a similar talk in 2021 that was also greatly appreciated by the audience.
that's
And
correct.
I
Yes.
thought you would be a terrific guest, so here we are.
Well, thank you very much for the invitation. It's my pleasure, really.
Okay, terrific. So by way of introducing you, Dr. Mendez is a pulmonologist and is board certified in internal medicine, pulmonary, critical care, and sleep medicine. He believes that the needs of his patients should always come first, and as the medical director of the Sleep Disorder Center, Dr. Mendez takes a special interest in providing a comprehensive sleep evaluation and treatment for children and adults with complex sleep conditions. And I mentioned this upcoming recording during a recent visit to my primary care physician, Dr. Mostino, and he was pleased to hear about it. And I asked if it would be okay to give him a shout out since you know each other. And since he
Yeah,
said
I know
yes,
Dr. Mostino for many years. He's a great guy. Great
yeah,
guy.
that's terrific. He said the same about you. And so I'm also going to use this as an opportunity to give my favorite doctors that are my doctors a shout out, because I have my favorite doctors who are my doctors and then my favorite doctors who aren't my doctors. I've become friendly with
Yeah,
a group of LinkedIn physicians.
yeah,
But since you know most of them, I would also like to give a shout out to Dr. Savino
yes,
and Dr. Lizawat
yeah,
and Dr.
yeah,
Falter
yeah, yeah.
and Dr. Cohen-Urim
Mm-hmm.
and
Great
Dr.
guys.
Sangavi.
Yes, yes. All
And
great people.
yeah, and my breast surgeon, Dr. Ashikara, you may not know him. He's in Westchester, but he's
Mhm.
amazing too. And I'm actually going to throw in my dentist, Dr. Gutierrez, because he's also amazing.
Perfect. So
And
you got a great team there.
I do. And actually, I recently interviewed Dr. Jeff Michaelis. You probably know him too, right?
Yes, I do.
And,
Yes, I
and he
do.
said,
Yeah,
yeah, those are great doctors. And I said, I know that.
yeah, yeah, yeah. But they are.
And I wouldn't trade them for $1 million. And everything I'm doing is actually because I was looking for ways to support them. And all of this has happened instead. So just the biggest thank you to my doctors. I appreciate you more than anything. And you're in my heart all the time. And I'm sure you'd be on that list. You're one of the few ologists I haven't seen in the past few years. So hopefully we can keep it that way on a
Absolutely.
doctor patient level.
Yes, yes.
um,
Well,
Go
it's
ahead.
really great to be with you, and I really appreciate the opportunity. It's my pleasure, as I said, and uh, anything we can do to support ourselves as physicians and to support the well-being of our patients, I'm all for it.
Exactly. And that's what my YouTube channel is primarily about, finding ways to support and motivate and encourage physicians. And there's actually so much you and I've mentioned that we could talk about, that our plan is to divide it into 2 episodes if we can find time for you to come back again. And
Yes, sure.
today we're going to be talking about doctor stress and sleep. And then hopefully in a future part 2, we'll cover sleep disorders and when to refer patients.
Yeah, that'd be
So
great.
good.
That'd
So
be great.
as we get started, what would you most like our audience to know about you?
Well, just as a way of introducing myself, I'm a father of two. I have two beautiful children. They're adults now. My oldest, Josephina, she's 27. She's a PhD in Harvard in Boston. She's studying breast cancer, so she's working in research on breast cancer. She's a smart kid, beautiful young woman who's getting married next year, and we are all excited about her. And my youngest is 21. His name is Juan. His name is Juan, and he's doing molecular. He's doing computer science in Williamstown, Massachusetts. We miss them. They left the house, few years. It seems like forever. You think that kids are going to be young forever, but they leave the house, and they leave you empty nested. So we are going through that process. I'm married. My wife, Anna, is a stay-home mom. We are both from Argentina. We immigrated in 1999. When I came in, my idea of coming in was going to be my residency in Danbury Hospital, and then after that, potentially going back to Argentina to do some critical care. And one thing led to another, including a crisis in Argentina, some opportunities that came in later for my fellowship at Mayo Clinic, and we decided to extend it. And we are still here, became citizens, and we love this place. We love this country. We love Connecticut. We love Danbury. I met an outstanding group of docs in the pulmonary department that absolutely could not change them for anything, no matter what happens. When they gave me the opportunity to interview as an attending and come back as an attending in pulmonary critical care, I had nothing to say other than thank you for the opportunity and tell me where to sign. It was one of those things that I'm here because of the community. I'm here because of the people in Danbury. And as I said, the group of people that I work with is just, you don't find that anywhere else. And it's for them that I feel motivated to do this too, because we all went through a major event known to everybody now, COVID, and everybody went through it at some level with some level of stress. But us being pulmonologists and being critical care doctors, we were absolutely in the front line. We were not the only ones, but the very few that were there in the hospital. When everybody left and all the offices were shut down, we were the ones taking care of patients with this critical illness, and we were the ones intubating them, and we were the ones on the front line. In fact, I still remember to this day my very first contact with COVID, which was a patient that was case 0 for Connecticut. The first case that happened in Connecticut was a patient of mine who came in from a trip from California, and I was on call on a Saturday. And the Department of Health was here, the infectious disease department was here. My boss was bedside with me, and everybody was looking at each other and said, what do we do now? I had a conversation with somebody, one of my colleagues in Italy, who they were going through the big part of the major disaster that happened in Italy around there. And we were having conversations on the phone of what to do next, and how do we deal with this? How do we deal with that? What do you think about this? So we were kind of playing by the book of critical care, but shooting from the hip, if you know what I mean. It's just kind of doing the best we knew about general critical illness in this condition, but many of the things and decisions we made were kind of our best educated guess. And thank God he made it through. He came out of the hospital. He has children. He sends us photos of how well he's doing. But I'm not gonna lie, that was a major change in my career. I think of COVID as before and after COVID for me, in terms of how I think about myself, about my patients, about my work in the intensive care unit. And I have dealt, ever since I became a critical care doctor, with very sick people, and many of them suffered great illness, but COVID was something different. And I use it as a kind of a way of an introduction to what I'm about to talk about, because I think that COVID, if anything else, made me realize of how fragile we are as physicians and as humans, and how things can change from a minute to minute. And I always have that in my head, that picture of when they teach you on the airplane, when the pressure drops, you put the mask first on your neighbor, on yourself, and then on your neighbor, right? And I always thought, well, that doesn't make any sense. But now after COVID, I think it does, because if we didn't take care of ourselves, we would have not been able to save the hundreds of people that we did save. So the issue of talking about sleep and stress and taking care of ourselves as physicians is a conversation that has been ongoing, and I have been part of Danbury Hospital's efforts in dealing with burnout, in physicians burnout, and physicians stress levels, and being myself a sleep physician, it kind of there were two interesting topics that came together, and I have some ideas. And since COVID, I think is when everybody started paying more attention to our own health as physicians and as providers, and everybody started to think, well, how do I make my life a little bit better so I can make others' lives better? And I think that's it's a topic that we don't always talk about, the health of the providers or the well-being of the providers, like I say, more than the health, because each one of us have our own health issues, but the well-being is a topic that involves how we relate to each other, how we interact with each other, how the job affects us, how we manage the stress levels that we are every day exposed to. I'm post call today after being on call all weekend, and I can tell you I went through a tremendous amount of stress, and I need to make an effort every time that I go through this to really, really work on myself so that I can be better tomorrow to continue to do this. And I think sleep is perhaps one of the things that had, even though I'm an expert, I'm actually a sleep board certified physician, I never understood the implication of what could sleep deprivation can do for somebody's career. So that was a very long introduction. I also want to tell you, I have a dog that I love. He's a German Shepherd. His name is Otto, and he's from Slovakia, coming directly from there. In fact, he came in with a passport. I love the guy to death. I walk with him as much as I can. We enjoy walks with my wife. I do running, not as much as I used to. I run one marathon, but I did a lot of 5K races, and I enjoy competing. Right now, I'm slowing down the competing part because I'm much slower than I used to be. But I still enjoy that mental reflection and moment that I get with myself when I run, particularly those long runs on the weekends that I didn't have to be on call. They were absolutely lifesaver for me. Just running for me was a form of meditation, and it still is. Being an Argentinian, I absolutely love soccer. I'm very much involved in every game right now in the Copa America, and I enjoy drinking yerba mate, which many of you may or may not know about, but it's a very popular drink in Argentina. It's like a tea that we enjoy every day. And my life is very simple. I have a sister who lives in Detroit. I go visit her every once in a while. My sister is a scientist. She works for the Henry Ford system. And my dad passed away before COVID, but my mom's still living in Argentina, and I'm planning to go visit her in July. So looking forward for that. My brother is a physician too. He works in Argentina in a university. He's a teacher, and he also does emergency medicine. So he works in an emergency room. So that's my life.
Well, thank you for sharing all of that. And I just want to say from the bottom of my heart, just thank you from a grateful patient, for what you did. And a lot of doctors' offices for a while closed during COVID.
Yeah.
A lot of people worked remotely. I myself had surgery for thyroid cancer in November 2020. And then unfortunately, I needed radioactive iodine, and we had this meeting to go over all the particulars of it. And I remember we had to sit at a table. It felt like 10, 20 feet apart, right? Back then.
Yeah.
So I went through all, and then I had breast cancer twice during the pandemic. So I've had many doctor appointments, and I understand, everything, and just things changing on a dime, and just worrying about keeping yourself safe, your staff safe, your patient safe, your family safe, everybody. It's very, very scary. So just thank you for doing what you do.
You're very welcome. And, I feel, I always feel that for me, one of the greatest rewards as an intensivist is seeing somebody being wheeled out of the ICU in good shape and good health, or even some of them walking out of the ICU. During that time, it was a scary moment where the whole entire hospital was COVID, and we were pretty much single-handed with our residents managing people that were dying almost the same day they came into the walls of the hospital. So it was a very scary moment. Thankfully, I had great support from my institution, which I'm very grateful for. They gave me everything that I needed for, and I think they supported us as intensivists in controlling this crisis best they could. A lot of our staff was incredible. One little thing that I can mention that is somewhat of a funny story that I can tell you. That same day when we were donning and donning in and for the first time and getting all the equipment to walk into the room for this patient so we could intubate him and put central lines and all of that. He was very sick. I took all my jewelry, including my wedding ring, and just put it in a little baggie and left it in there. Everything was so chaotic and it was messy and nobody knew what to do. And well, what I kind of thought it could have happened. The ring disappeared. The whole baggie went somewhere in between the whole garbage pile of things and the stress. And I didn't realize until like later that night when I stabilized the patient, that I was missing my ring. So I called Anna, my wife, and I said, "I'm so sorry. I think I missed." And she said, "You're fine. Don't worry about it. Just take care of yourself, blah, blah, blah." And one of my staff persons that it was absolutely love her. She was someone who serves almost as a secretary slash staff support in the ICU. She actually went all the way down to the dumpster, dumped herself into the dumpster and started searching until she found the baggie, found the ring, and brought it back to me at midnight and said, "Dr. Mendez had found it." And to this day, I cannot believe that act of heroism in the middle of a nightmare. Imagine that. And she was worried that I had lost my ring. It was just an incredible moment. I still have pictures of me holding the ring with the team around me at the same time that we were kind of doffing and donning with equipment, not knowing what the virus was look like and how did we get exposed to and how do we prevent ourselves to get sick. And we were just learning how to mask and don and put all the poppers on the equipment.
Right.
And it was just an incredible thing. Just how worried she was about me losing that ring. It was just surreal. And I in the midst of all of that stress, and we were pretty much doing what we always do, which is give ourselves 150% to the patient.
Mm-hmm.
But after a few weeks of that, working day and night, 12-hour shifts, we all quickly as a team realized that we needed to conserve ourselves and we needed to manage our energy and manage our health. And it became very clear that we needed to have at least two or three doctors at the same time. One doctor couldn't manage 15 people critically ill at the same time. So we needed to divide and we needed to pay attention to our own health. And that's when I became the most interested in burnout and in our own providers' well-being and what it meant psychologically and physically, right? And then if you divide that up and you say, well, what are the pillars of well-being? Sleep is my number one priority, even I would say on top of nutrition and exercise. And I think because of how easy you can actually rearrange your life sometimes and make your sleep better to work with you and in your favor to make it a kind of a tool to make you more efficient, almost like if you're a soldier and you need to be active and you need to be awake and you need to be alert. Patients need you right now and they need you awake at your best and they need you at your 100%. And if you're not sleeping enough, if you're not sleeping properly, that becomes a big deal. So I want to put that as a first element of my talk because that's what we're going to talk about. But I truly believe that is one of the best tools and easiest tools that we have in our armamentarium to improve our well-being as providers. I'm going to go next to nutrition. And I've been learning and reading more and more about nutrition more than ever for my own health for the health of my partners, and we've been chatting and sharing ideas. And Bob is my own doctor, and he helps me with my metabolic issues, and we have very deep rooted conversations about nutrition, stress, friendship, and all of the above. And then exercise, right, which uh, leads me to another story. During that time, I was living in the basement. I made the decision to separate the basement out of the house as my own place. Thank God I had an opening to go in and out of the house without going in. My biggest fear was not for myself, but for my family. I did not want to get them sick. And since I was working with COVID, 15 inches away of people coughing with COVID, I said, you know, I may go down, but the last thing I want is my family to go down with me. So I lived for 6 months straight in my basement. So my basement, which I'm now sitting on, became my home. And I made a little kitchen. I made a little bathroom place. I have a bed. I have a TV, and my wife was giving me the meals, and I would pick them up from the stairs and bring them down. And in this basement, I have so many memories of that time. But one that stuck with me was and I'm gonna tell you that this is from the Y, the exercise team in Newtown. They have a gym. They call it Youth Academy. I think there's something is in Fairfield. At the time, they were, as a gym, they were close enough. Nobody would go to the gym, but they actually dedicated. They did something wonderful, which is they donated their time and expertise to providers, and they said, "Look, would you be willing to do what we're doing now? Just put me on an iPad, and I'll teach you how to exercise. I'll teach you. You show me what you can do. I'll show you how to do, squats. I'll show you how to do." So this guy was with me once a week for free, right?
Wow.
A complete stranger who donated his time. I said, "You know what? I want to do this for you."
Wow.
I didn't pay him a cent. So he communicated with me every week. He sent me his exercise protocols, and I was in front of an iPad doing it with him. And he was doing it in his own house, in his own gym. So do this, do that. And we kind of graduated of things later on. I'm still in debt with him because he literally planted in my head that seed of the importance of exercise and move your body every day. You get up in the morning after a long night, you get up, you sleep some hours, you get up, you move your body, you do some squats, some exercise, you drink. He was going over how much water I had, things of that sort. So that to me was incredible. I think that people don't talk enough about what the community did for us. I think everybody knows how much we invested in this, but the community was just incredible. They were bringing us food, trucks of people coming in with pizza boxes piled up in the hospital's door, people giving us gloves, people giving us donated masks, you name it. It was just an incredible pouring of support all at the same time, which is overwhelming. But, going to the topic of our discussion about my initial thought about this and sleep and burnout and stress, I think, basics, important stuff that people need to know. Number one, a human being, an adult, needs about 7 hours of sleep. No matter what people says or reads or listens on online, you need that amount of sleep. You really need 7 hours of ideally uninterrupted sleep, although we are now realizing and knowing by some studies that even if you can do it because work, and that was a perfect example during COVID, you could spread those 7 hours in 24 hours in whatever period of time you can get them. So the science now is saying, well, maybe, our ancestors and in the caves didn't sleep 7, 8 hours because they couldn't, because they were awakened by animals trying to kill them and threats. And so the body was designed to every 90 minutes have an episode of a micro alertness that we call, where you are okay if you wake up. So even if you get 90 minutes periods of sleep separated for whatever period of time, as long as you accumulate in a 24-hour period, 7, 8 hours of sleep, your body's okay, but you need 7 hours of sleep. Now, one important detail here is the circadian rhythm, which has to do with the light, right? Our bodies function better if we align our sleep and eating schedule with the circadian rhythm of the sun and the moon, so that ideally you want to eat when there is light, and you don't want to eat when it's dark. And the longer you can stay your period of fasting, the better it is. So the less you can eat, the better. And the longer than fasted the period, sometimes the better. Ideally 12 to 16 hours of fasting during the nocturnal period. And your sleep should coincide with the nocturnal period. That's the way that our bodies function the best. That's the best our hormones function the best. And if you align your sleep with that darkness period, it will be easier for you to fall asleep and stay asleep, because you're aligning a chemical in your body called melatonin, which we produce in the evening. And if we don't interrupt that by watching TV late or using the iPad or the phone, you could see how you could enhance your quality of your sleep by realigning your own circadian rhythm with the cycle of the sun and the cycle of the moon. So in other words, if we respect that, and again, I'm going to get back to that in a minute, because this may apply to my colleagues like myself that work at night many times, that we are going against that. So there are some tools and things that I've learned of how do we counteract that effect. But in general, for everybody that works during the day, very important that you go to bed early. And by early, I mean 9, 10 o'clock, that you have a light evening meal, that your evening meal should be the smallest meal of the day, in my opinion. It shouldn't incorporate any caffeine or any sugar if you can avoid it, because I learned very quickly how bad caffeine can be, even though I was making all of this classic mistakes of drinking more coffee, trying to stay awake and trying to be more, alert. I quickly realized that it was impacting my sleep. So the first thing I got rid of was my coffee. So I went from 2 or 3 cups of coffee to 1 cup of coffee to none. Now drinking mainly yerba mate if I can, to kind of get that caffeine boost that I need in the morning, but minimize the caffeine. And that reminds me of another issue, which is caffeine can be very long lasting in your body. And for someone who has sleep issues, even 1 cup of coffee could be too much. We as doctors love coffee in general. We enjoy it. We like it. We like to drink it when we're working. But again, if you don't watch that, it can hurt you. So that's one little piece of advice. Other than the light meal in the evening, avoiding any source of blue light in the evening is absolutely crucial. And by that, I mean not reading from the iPad or the phone, but reading from a book and a piece of paper with a dim light in the evening, so that you don't get any light exposure in the evening. So I learned pretty quickly that I need to give up my coffee. I learned pretty quickly that I had to give up the alcohol. So I used to enjoy a glass of wine here and there. Didn't do it every evening, but when COVID happened, I gave it up almost completely. I still drink occasionally 1 beer, 1 glass of wine every so often with my friends, but I really, really avoid at all costs alcohol in the evening at any, because I really understood how it could impact your sleep. And I think more and more information is now coming out in the health community that it could be helpful if you overdo it, for sure, but even a small amount of alcohol can affect you. So that's my own choice. I realize that people can enjoy the glass of wine occasionally, but when they ask me what should I do with my glass of wine in the evening, I say, well, that if you drink alcohol, your sleep will be worse. If you have insomnia, probably that will be one good place to start, eliminating caffeine and alcohol. So I reorganized my schedule so that I could get 7, 8 hours of dark, absolutely dark, pitch black room with a cool temperature, 65, 67 degree, no matter what the period of the day it was, because I had cycles of 7 days where I was working only nights. I still do that now as an intensivist. We do 3 or 4 nights where we work all night and then we sleep during the day, which is more challenging. But as long as you create an environment in your basement or in your room where your curtains are closed, you can sort of mimic that darkness episode. And as long as you continue on the same cycle, you can adjust. So, very important also for people to understand, and I think all my colleagues know this, the community is learning about this, how important is the amount of sleep we get, not only the quality, but the amount. And I think many more studies are now coming up and associating sleep deprivation, meaning less than 7 hours for an adult, with all sorts of bad health outcomes. And I'm talking hypertension, strokes, atrial fibrillation, stress, dementia, depression, anxiety. To say a few, name a few. One that directly affects me is diabetes. I don't have diabetes, but I have pre-diabetes, which is pretty close. And I have a continuous glucose monitor device, which is a little piece of plastic that connects to my phone and tells me what the glucose is. I can tell you when I have been on call and I've been stressed and I have been working nights, sleeping 3 or 4 hours, my glucose raises up. So this is a very practical way of physicians to monitor themselves. I'm not arguing that night shift workers should have a continuous glucose monitor on every time, but I think it's technology now that is available and it's accessible to us that we didn't have before, that is allowing us to take better care of ourselves. So I think that the amount of sleep I was going at is important. The quality of sleep is another one. And I always tell my colleagues, make sure that you don't snore at night. And if you do snore, make sure you have a sleep study. They're very easy to do. You can do them at home. It's the equipment is simple. You don't need to even, I'll be honest, I'm a sleep doctor. I'd love for patients to come and consult me for this, but many of the things are now available online. You can fill up a form and you get equipment in your home where you can get the test done. I think that for someone who has simple snoring and mild to moderate sleep apnea, which is the condition where your breathing gets stuck or you stop breathing at night because of the snoring, I think that awareness is the most important thing. There are 30 million people in the US who have this condition now. And I always tell my colleague, when you sleep, make sure you ask your wife or your significant other, ask them, do you think I snore at night? Or you'll know because you'll wake up with a dry mouth. You'll wake up with a little sore throat in the morning, with a headache. Those are the signs that you could have obstructive sleep apnea. So I have sleep apnea. I sort of self-diagnosed it with the help of my wife, who was complaining about my snoring. And I did my sleep study, and I realized quickly that I have a form of sleep apnea that could be treated. So I ended up going on treatment. And that helped me tremendously because before I didn't know it, I had days where I was in a fog. I was really drowsy, tired, fatigued, and I thought I was overworked, which I was, but it was a little bit more than that. And many physicians don't really, even though they think of the condition for patients, I always tell them, look, you may consider getting a sleep study yourself. Why don't you do this at home? I can help you. And I have tons of colleagues that we chat in the emergency room, and they tell me their stories. And I said, why don't we get a sleep study? And they have it. So it's one of those easy conditions to treat. We do have devices that treat sleep apnea very easily. And we do have other means of treating it without CPAP. CPAP is the little machine that provides air to the airway in a way that prevents that collapse to occur, and is perhaps the most common way of treating sleep apnea. And I'm on it. I use it every night. I absolutely love it. I don't think I can sleep without thing. And it's something that physicians sometimes don't really want to know about, or they say, I think I'm just not sleeping well. I'm tired because I work too much, or I'm tired because I'm staying up late doing charts or filling up paperwork. But the reality of it is we are all the same. We are all the same. We all have the same diseases that all of my patients have. So why would we be any different? Why are we vaccinated for all of this? So once you step off that box and you start thinking, maybe I have this, maybe I should check myself for sleep apnea. So that's another thing that improved my quality of sleep tremendously, realizing that I had sleep apnea and treating it. So, and now that's what I treat. That's my expertise. And you could say you didn't recognize it. You had it yourself, when you are treating your patients.
Mhm. Yeah,
So
well,
go ahead.
no, I just wanted to thank you for stressing the importance of rest to physicians and how they need to
Yeah.
take their own advice that offer their patients and prioritize rest for themselves. And you've talked about why it's so critical. So how can our listeners get in touch with you? Because we have a lot more to talk about. So this is going to be continued.
Yeah, so I can give you my office phone number. Is 203-739-8330. They can contact my office anytime. Many of my colleagues, we run into each other in the hospital when we work together, and they gave me some questions about sleep issues that they suffer themselves. They later became my patients, and I treat them up to this moment. So I have tons of my own colleagues as patients, and I think the more we talk about this, one of the things about sleep is it still has some um, I don't know how to say it. It's almost like people is embarrassed to talk about it. Even I think for women it's a little bit more. I have the sense that women have a little bit more of a sense of shame about snoring. Men probably less, but even then, still, I find that many of my men colleagues, they underestimate the significance of this. I just want to mention to all your listeners, that snoring is not benign. People says, well, snore and so what? Everybody does. Well, there are plenty of studies that have shown that patients that snore have an increased risk of hypertension. Okay, so we got a little interrupted there. I went over time. That's my fault. I usually tend to talk too much, and I went over time. But I was talking about snoring and recognition of um, sleep disorders, and this could be a little bit of a segue for our next talk, Kim, where I could go into more deep details about each one of the main sleep disorders, and that could be information that could be useful not only for providers but for the entire community. People that could be listening to this and say, I think I have that, or I think I've heard my wife or my husband saying that I do that at night. Maybe I should have that checked, because snoring, I was saying, is not a benign condition. It should be paid attention to. Even occasional snoring is not a big deal, but if it's persistent, and if it is accompanied by this snorting sound, very deep, and episodes of pauses in the breathing, that could be a sign of sleep apnea. And it's a risky condition that leads to an unnecessary increased risk of heart attacks and strokes. I have been in big studies, participating as authors of the studies that shown that is an independent risk of stroke in patients with atrial fibrillation. So that I pay a lot of attention to snoring and sleep apnea. I think that it's one of those low-hanging fruits that we have that we can treat very easily. Now we have a tremendous advantage because we have a lot more knowledge and understanding of metabolism, nutrition, health. We have wonderful drugs to battle obesity. So I think there's really no excuse not to treat snoring and sleep apnea anymore. So kind of to summarize and to put this together, I think for physicians, and I'm doing this as not only as a sleep doctor, but as someone who has made tons of mistakes going through a pandemic and being in the middle of the most stressful moment of my life, trying to deal with critical ill patients, but also trying to keep myself afloat in the middle of an illness that I had myself during that time. I recognized the importance of sleep very quickly, and I said, everything I learned in fellowship makes sense now. I think what I've been telling patients, we need to also apply it to ourselves as providers, because if we don't put that mask on ourselves first, when the plane goes down, we're not going to help the other guy beside us. So please take care of your sleep. Don't drink alcohol, don't drink coffee, do plenty of exercise, go to bed early, make sure your room is dark and cool, make sure that if you snore, you have that checked, and pay attention to those details of how you feel in the morning, how you feel when you wake up. And the first thing that I do when I wake up in the morning, I prepare my yerba mate and I go out with my dog and try to get sunlight, right? The first thing you need to do, you need to get out of the bed early in the morning, try to catch that early morning sun, which is not bad for your skin. And you need to catch that for your vitamin D, and you need to get that eye in your eye, that light in your eyes, that kind of sets the whole pattern of your day. And I found that by being regular about my sleep and getting up at the same time when I have the opportunity of sleeping at home, which is not often now with work, but I get up in the morning, go out with my dog, and we enjoy that moment in the sun, which, with my feet in the grass, no shoes,
Mm-hmm.
because I truly believe in that true connection of energy with the ground. So grounding myself, looking at the sun, drinking yerba mate with my dog just for 5-10 minutes. That's my meditation every morning, and I think that kind of completes the cycle. And then after that, you get your smile on, and you go to the hospital. I put my critical care pajamas on, and off I go to the ICU to take care of my patients. So I hope that I truly believe that if we take care of ourselves, we will be better doctors for our patients. I truly believe that sleep is paramount, and not only nutrition and exercise, but be careful with your sleep. I cannot emphasize that enough.
Well, thank you very much, Jose. And I love everything that you've said. And it's things that doctors would tell their patients. So who better to speak the same words to doctors than a sleep doctor? So,
Yeah.
so everybody should listen to you.
Well, I appreciate the opportunity, Kim, and all the best for you. And I will be available to anybody to call my office for questions, or if they can email me at the work email that you do have, Kim, and you're welcome to share it to anybody who wants it. And I'll be happy to talk more about medicine, friendship, relationships, and in the hospital, how to deal with being on call and being sleep deprived, to anybody who wants any advice. And I can tell you that more about to deal with these issues from my own experience, from reading it from books. And I think as I get older and I get more experience, I can actually pass it on to younger doctors who are starting, making the same mistakes that probably I made when I was their age.
Yes, absolutely. And medical students and residents, the earlier you can hear this, the better, right? And start your
Yeah, absolutely,
career off
absolutely,
on the
absolutely.
right trajectory.
Never underestimate the importance. Never underestimate the importance of having a good mentor or a good friend in your group. And going back to my team, which I absolutely adore and respect greatly, every single one of them could be my doctors, and I feel so honored to work with them. And I always look up to them, and I feel that having that relationship with your coworkers is another important piece in the successful story about being a physician.
Yeah, absolutely. And we talk about that a lot on LinkedIn and other episodes. The importance of connection and a sense of community cannot be
Yep.
underestimated. It's
Yep.
everything, right? It is.
Yes. Yes. Yes.
So,
Yes.
okay, well, thank you very much. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
Thank you very much for what you do, Kim. Thank you.
You're welcome, and thank you, Jose.